Hello, thank you for joining us today. Today I will be translating the following PowerPoint for Dr. Nassaro. Let's begin. Dear colleagues, this report will present a brief overview of the physiological activity of medical gases using the example of the most popular representatives of this family, ozone, xenon, and hydrogen, and also the concept of conditioned reflex hormoligos as the basis of the systemic therapeutic action of medical gases will be proposed. At the moment, there are several independent areas of treatment with medical gases: ozone therapy, xenon therapy, NO therapy, carboxytherapy. The direction of hydrogen therapy is also beginning to form. All these areas occupy a marginal position in medicine. The reason is that the main trend of modern medicine is the pharmacological approach to treatment, which is practically not used in medical gas therapy. How can this situation be corrected? Figuratively speaking, the ticket for the introduction of a new pharmaceutical agent into the club of modern medicine is four control questions. Number 1, about pharmacological qualifications. Number 2, about the therapeutic index. Number 3, about the spectrum of pharmacological activity. And number 4, about the mechanism of action. So about qualifications, in 2009, Nikolai et al. Proposed to consider med gas as antioxidants. We will not argue with the authors. We will only pay attention to the fact that all these gases, except for hydrogen, are poisons. As we will show below, this property determines the breadth of the spectrum of pharmaceutical activity of medical gases. In addition, if we follow the NaCl concept, we must place medical gases in a subset of the metabolic group. We must see that this would be a clear narrowing of the pharmaceutical properties of medical gases, since they also exhibit bigotropic, immunotropic, anti-inflammatory, antimicrobial, and anti-tum or effects. And there are three main types of pharmacological classifications of drugs. Number 1, by chemical structure. For example, salicylates, benzodiazepines, etc. Number 2, by therapeutic effects, vasodilators, anesthetics, antimicrobial, etc. Number 3, nosological principle. For example, agents for the treatment of myocardial infarction, bronchial asthma, etc. Take, for example, ozone, hydrogen, and xenon. The first gas is the strongest oxidizing agent. The second is known as a reducing agent, and the third is an inert substance. There are no more contrasting substances in terms of chemical classification. At the same time, they have almost identical spectra of pharmacological activity. True, this spectra of pharmacological activity also look absurd from the point of view of classifications according to the nosological or therapeutic principles. Does it follow from this that the pharmacological approach is not applicable to the named medical gases? Definitely not. The coincidence of the spectra of pharmacological activity is such an important circumstance that it cannot be accidental, or there is certainly a single mechanism of action behind it. Attempts have already been made to find a key to understanding this paradoxical situation. We propose an alternative approach that organically combines all the listed types of pharmacological activities of medical gases, including the antioxidant ones. For this approach, the seeming paradoxically of the coincidence of the pharmacological activity spectrum for the strongest oxidizing agent ozone, reducing agent hydrogen, and inert gas xenon no longer seems incredible. In the course of this report, we will pay attention to, number one most important feature of the effect of hydrogen, ozone, and xenon on the body, and two fundamental forms of reaction of any life forms to change in the internal and external environment. Awareness of the importance of these three circumstances we called 3 steps to understanding systemic therapy with medical gases. After we have done these 3 steps, we will need to take another half step towards the pharmacological classification of medical gases. Relatively recently, in the work of Thompson et al., it was shown that inhalation intoxication with ozone in a dose-dependent manner changes the level of transcription factors, interleukin, IL-1, chemokine, CC, TNF, and HIF in various organs. The same effect is caused by an increase in the level of corticosterone, which plays the role of cortisol in rodents. Effects of ozone and cortisol correlate well. These transcription factors are known as markers of oxidative stress. Therefore, the correlation between the action of glucocorticoid and ozone may seem random if the synthesis of messenger RNAs were not blocked by miraparin, a specific inhibitor of corticosteroid synthesis. Other authors have directly shown the inhalation of ozone leads to the release of corticosterone from the adrenal glands, which is blocked by miraparin. It has also been shown that demodulation or bilateral adrenalectomy significantly reduces the toxic effects of ozone inhalation. This provides compelling evidence that the toxic effects of ozone and activation of the adrenal cortex are causally related. Is this conclusion valid for therapeutic doses of ozone or for ozone administration methods, typically for ozone therapy? The slide shows one of the experiments to study the dynamics of cortisol during the course of ozone therapy. As can be seen from the chart, with the beginning of the course of systemic ozone therapy procedures, a sharp dynamics of cortisol is observed, which, after a number of fluctuations, stabilizes again, but at a new level. A characteristic dynamic of cortisol concentration during a course of 6 treatments is shown in the slide to the left. On the right is the aldosterone pattern. Fluctuations in the concentration of corticosteroids occur mainly within the normal range. However, this does not diminish the fact that multiple changes in the end, these bioregulators. We have brought these graphs on one slide to illustrate the position of the so-called Hans-Seele pendulum. By this term, he meant antagonistic fluctuations of glucocorticoids and mineral corticoids, which in his opinion reflect adaptive tuning through the transition from distress to eustress. If Seele had survived to this day, he would have admitted that ozone triggers his pendulum of adaptation. Glusov and Naumov in 2007 showed that another medical gas, xenon, also has a pronounced effect on the endocrine system in general and the adrenal system in particular. The study was conducted on a group of healthy volunteers aged 18 to 40 years. Blood for analysis was taken 60 minutes after the end of short term, several minutes, inhalation of the xenon oxygen mixture, 50-50. One might get the impression that of the three gases under consideration, only xenon and ozone affect the hormonal system. This is not true. For example, molecular hydrogen dissolves in water causes the activation of the secretions of the hormone ghrelin from the stomach walls. The mechanism of the induction of ghrelin synthesis is not yet fully understood, since it is blocked by atenolol, which is considered specific for B1 adrenergic receptors. However, the ghrelin reactivity of hydrogen is very important, since it explains the activity of hydrogen in experiments of models of neurodegenerative diseases. Detailed information about this can be obtained from the report of the author of this study, Dr. Noda, who takes part in our conference. It is important to note that only the endocrine, but also the immune and autonomic nervous system is involved in the formation of the reaction of organism of medical gases. This is evident from the fact that during the course of ozone therapy procedures, the levels of leukocytes and the parameters of the cardiointervallogram show remarkable dynamics. During the course of hydrogen or xenon therapy, there is also an oscillatory change in the parameters of the local formula and cardiointervallogram. The next step is the acknowledgement of fact that the pharmacological effects of the medicinal gas consist in the formation of a conditioned reflex anticipatory protective homeostatic reaction formed on the basis of a number of innate homeostatic reflexes. The slide shows a summary table of the toxic effects of ozone. Data sources for the table are indicated at the bottom of the slide. As can be seen from the table, inhalation intoxication of rats leads to an increase in blood viscosity, an increase in erythrocytes aggregation, an increase in erythrocyte sedimentation rate, an increase in hematocrit, a decrease in deformability of erythrocytes, and pro-inflammatory effects, vasoconstriction, an increase in cortisol levels, suppression of immunity, an increase in levels of adrenaline in the blood. For clarity, deviations from the level of the norm are shown with arrows up and down. We see that therapeutic effects of ozone are simply a mirror image of the toxic effects of this gas. Consequently, the body reflexively protects itself from the toxicant in small therapeutic doses simply by developing reactions opposite to its toxic effect. By definition, toxic substances are substances that cause disruption in the vital functions of the body. In this sense, xenon can be considered a toxicant, nervous direction of action. In relation to this toxicant, the body also develops a reflex defense reaction aimed at weakening the toxic effects of xenon on the nervous system. As this ozone, the protective response of xenon is also largely a mirror image of the toxic effects of the nervous system. This can be seen from the table on the slide. The table is compiled on the basis of scientific publications presented in the tables. Thus, after a course of intoxication of the patient's body with ozone or xenon, we see a long-term manifestation of the mirror's protective reaction of the body even in the absence of intoxication with these gases. Can this be considered as the formation of a conditioned reflex homeostatic reaction? But is it realistic to form such a conditioned reflex? As you know, a conditioned reflex is formed only on the basis of congenital unconditioned reflexes. Is there evidence that the body has an innate homeostatic reflex system? Yes, there is such evidence. Below are 5 examples of such reflexes. In the first example, let us consider the formation of a conditioned reflex to the introduction of glucose into the dog's body. Intravenous glucose leads to a temporary increase in blood glucose levels. If the intravenous glucose injection is repeated daily, then the next injection of saline solution instead of glucose causes a paradoxical decrease in the concentration of intravenous glucose levels. This is easy to explain when you consider that in response to an increase in blood glucose concentration, the pancreas secretes insulin. Thus, if during our experiment we would measure the concentration of adrenaline, then we would see the following picture. In response to each injection of glucose, the body develops a protective response in the form of an increase in the level of adrenaline in order to reduce the concentration of glucose to normal levels. If saline solution is introduced instead of glucose, the body responds by releasing adrenaline in order to protect the body from a possible increase in glucose levels. Naturally, in this case, the glucose levels fall below normal. Let us illustrate this experiment by trading scales for weighing. Suppose that if the glucose concentration is normal, then the balance arrow is set to the center position. When glucose is injected into the body intravenously, its concentration increases. In this case, insulin is released into the body, which reduces the growth of glucose in the body. If we imitate the administration of glucose by injecting saline solution, then insulin is released as a result of conditioned reflex reaction. The second example is the formation of conditioned hypotensive reflex to the introduction of adrenaline into the blood. The experimental setup is similar to the previous one, only instead of glucose, the dog is injected with adrenaline, which causes a sharp increase in blood pressure and extrasystole. After a series of such injections, the administration of saline causes a decrease in pressure. Let us explain the essence of what is happening on the same example of trading scales. Let the normal blood pressure correspond to the middle position of the arrow. The injection of adrenaline increases the blood pressure, which corresponds to the deviation of the arrow to the right. In response, the body activates parasympathetic system, which counteracts the increase in pressure. Ultimately, the system goes into a state of expectation of external hypertensive effects and responds to the hypotensive effect to the effect of the introduction of saline. I brought this example to show that the conditioned hemostatic reflex can be built not only on the endocrine, but also on the autonomic nervous system. The hemostatic conditioned reflex may require the joint work of the nervous system and endocrine system. This combination is required for a conditioned diuretic reflex based on a congenital unconditioned reflex of stabilization of the water-salt balance. The slide shows the conditions of the experiment. A gastric fistula is installed into the dog and the ureters are removed. After a portion of water is introduced into the stomach, the homeostasis system of the dog's body prevents the hypervolemia of the circulatory system by increasing diuresis. After repeated repetition of this experiment, the introduction of rapid evacuation of water causes the same effect of increasing diuresis, although there is no real absorption of water in the intestines of the animal. In experiments on studying the effect of chlorpromazine on the behavior of mice in the open field test, it was shown that the administration of a saline solution after a multiple repetitions of intraperitoneal administration of a neuroleptic to mice causes a sharp activation of motor and behavioral activity in mice, which is a consequence of a formation of a conditioned reflex and hyperactivity, which is a consequence of the homeostatic reflex of maintaining psychosomatic activity of the animal. We can also see the formation of a conditioned reflex of the immune system based on the innate reflex of maintaining the antigenic constancy of the internal environment of the body. In this experiment, the animal was injected intraperitoneally with sterile talcum while scratching the hair in a specific place. The result of the aseptic inflammation was the appearance of blood molecular cells in the intraperitoneal exudate. Further, simple scratching of the animal's fur led to the appearance of molecular cells in the exudate, which, as in the previous example, indicates the establishment of a homeostatic conditioned reflex, this time with the participation of the body's immune system. What conclusions can be drawn from these excellent examples? The reflex of maintaining homeostasis to any effect, including the effect of physiologically active substances, exists in the same real unconditioned reflex as innate reflexes of thermoregulation, cardiac, respiratory, and vascular. The homeostatic reflex is a universal means of correcting any disorder of the psychosomatic state of the body. Multiple repetitions of the effect of disturbing homeostasis leads to the unconditional fixation of the conditions of the external and internal environments accompanying the disturbance of homeostasis. In the above example, an injection, distension of the stomach, combing wool, etc. When one or more of these conditions are repeated, an anticipatory reaction develops in the body, the opposite of the action of the damaging factors. Thus, the unconditioned homeostatic reflex becomes conditioned. From the dichotomy of norm health and deviation from norm illness implies that the homeostatic reflex is a therapeutic reflex. In the third step, we postulate conditioned reflex hormoligos as the basic concept of the therapeutic action of medgas. Slide 29. Thus, the body is able to develop a conditioned reaction to a factor that provokes a violation of homeostasis. It is obvious that poisons in moderate doses used repeatedly can also cause a conditioned reaction, and this action will be inverse to the action of toxicant. What happens if we stop prescribing a toxicant? The advanced conditioned reflex homeostatic reaction of the body will continue until it fades for several months. If the pathogenesis of the action of a poison is similar to the pathogenesis of a disease, then a conditioned reflex homeostatic response of this poison will be a pathologically justified method of treating the disease. Here it is appropriate to recall the two wonderful aphorisms belonging to the founder of pharmacology, Paracelsus. Everything is poison and nothing is devoid of poisonous. Only one does make the poison invisible, and the founder of homeopathy, Hahnemann, Similia simbilis carentur. The like is cured by the like. In fact, the concept of conditioned reflex hormoligos proposed in this report is a synthesis and theoretical substantiation of the empirical laws expressed in this aphorism. Based on the above data, as well as summarizing the many years of experience in the clinical use of medical gases, we propose the concept of Pavlovian conditioned reflex hormoligos as a theoretical basis for describing the therapeutic activity of medical gases. From the Greek, hormoi, sets in motion, activates the hormonotropic effect, and oligo in a small amount. Concept essence. The course of parenteral therapy with ozone and xenon is a procedure for the formation and development of a homeostatic conditioned reflex to a toxic substance. A number of signs, the effect of the endocrine system, and the literature data on the pro-inflammatory action of hydrogen show that this gas also disrupts homeostasis, and it is in its own way. It is also capable of causing an unconditioned hemostatic reflex. Thus, the concept of Pavlovian conditioned hormoligos is that ozone and xenon and hydrogen maybe induces and fixes a conditioned reflex action, which is an advanced adaptation reaction opposite to its toxic effect. This reaction is the body's universal response to any poison. Why do we choose medical gases? Because the action of Mg is reversible and does not accumulate, unlike many other poisons. And also because the components of the body's detoxification response to ozone, xenon, and hydrogen may be pathogenically justified for the treatment of a very wide range of diseases. In accordance with the concept of Pavlovian conditioned reflex, hormoligos, and clinical experience, the nature of the action of the considered medical gases is as follows. Ozone practice shows that hormonal changes caused by the detoxification response to ozone are aimed at normalizing the hormonal balance to the level of characteristics of a younger age, which subjectively corresponds to rejuvenation. Xenon, the state of expectation of inhibition of nervous processes during inhalation with xenon, keeps the adaptive system in a state of mobilization, subjectively perceived as a surge of energy, efficiency, and optimism. Hydrogen is the only Mg, ¿quieres que diga Mg o es así? Hydrogen is the only Mg that does not have a noticeably pronounced toxicity. However, our practice shows that the combined use of this gas with xenon and ozone introduces an additional nuisance into the emerging leading homeostatic conditioned reflex. This is probably due to the fact that hydrogen modulates the body's hormonal response to xenon and ozone. In conclusion, we will answer the question of the relationship between the concept of Pavlovsky conditioned reflex, hormoligos, and existing ideas that the mechanism of action of medical gases. As mentioned above, the conditioned reflex homeostatic reaction of the body achieves the result by changing the hormonal balance in such a way as to induce the necessary protective reaction. By observing this defense reaction from the outside, we call this reaction the therapeutic effect of the medical gas. This explains the many-sided pharmacological effects of medical gases. Often this protective reaction looks like an antioxidant effect, which misleads us to consider the antioxidant effect to be the main one in the pharmacological activity of med gas. The table illustrates the idea of the proposed concept of hormoligos. The diagram shows that the endocrine system has a full range of hormonal agents that can mimic any known pharmacological effect of MG. For example, to develop homeostatic response to ozone to improve blood rheology, the adaptation system can activate the synthesis of renal erythropoietin, adrenal norepinephrine, and heart natriuretic peptide. Accordingly, adrenal cortisol and aldosterone and vasopressin can be used to compensate for the pro-inflammatory and vasoconstrictor component of ozone toxicity. The neuroendocrine immune system is embraced by multiple positive and negative connections, and the desired effect is achieved not suddenly, but through a series of trial and error, which we see as periodic deterioration and improvement of the patient's condition. When the balance is reached, the patient enjoys health, which we perceive as a result of changes in the concentration of bioregulators and byproducts of the synthesis. MDA conjugates factors of expression of protein genes participating in the protective reaction. In conclusion, we will answer the question that the relationship between the concept of Pavlovsky conditioned reflex hormoligos and the existing ideas about the mechanism of action of medical gases. As mentioned above, the conditioned reflex homeostatic reaction of the body achieves the result by changing the hormonal balance in such a way as to introduce the necessary protective reaction. By observing this defense reaction from the outside, we call this action the therapeutic effect of medical gas. This explains the many-sided pharmacological effects of medical gases. Often, this protective reaction looks like an antioxidant effect, which misleads us to consider the antioxidant effect to be the main one in the pharmacological activity of med gas. The table illustrates the idea of the proposed concept of hormoligos. The diagram shows that the endocrine system has a full range of hormonal agents that can mimic any known pharmacological effects of MG. For example, to develop a homeostatic response to ozone to improve blood rheology, the adaptation system can activate the synthesis of renal erythropoietin, adrenal norepinephrine, and heart natriuretic peptide. Accordingly, adrenal cortisol and aldosterone or vasopressin can be used to compensate for the pro-inflammatory and vasoconstrictor component of ozone toxicity. The neuroendocrine immune system is embraced by multiple positive and negative connections, and the desired effect is achieved not suddenly, but through a series of trial and error, which we see in a periodic deterioration and improvement of the patient's condition. When the balance is reached, the patient enjoys health, which we perceive as a result of changes in the concentration of bioregulators and byproducts of the synthesis. Okay. MDA conjugates expression factors of the protein genes involved in the protective reaction. Finally, we need to take the last half step and determine the correct pharmacological qualification of the medicinal gases used at a therapeutic concentrations. To solve this problem, the key point is the spectrum of pharmacological activity. Characterizing medical gases from a pharmacological point of view, we can state that they are anti-inflammatory, immune modulating, antimicrobial, antiviral, and anti-hypoxic, vasodilatory, cardioprotectors, detoxifying agents, substance with a therapeutic index of more than 350 times and half-life of 60 days. Yes, there are. This class of substances is called adaptogens. Adaptogens are anti-inflammatory, immune modulating, antimicrobial, antiviral, and antihypoxic, vasodilatory cardioprotectors, detoxifying agents, substance with a therapeutic index of more than 350 times and half-life of 60 days, which means that the spectra of pharmacological activity of medical gases and adaptogens practically coincide. Adaptogens traditionally include plant alkaloids of complex composition extracted from plant Rhodiola, rosea, ginseng, Eleutherococcus, Leucia, Aurelia, astragalus, centaury, lemongrass, etc. However, there are also synthetic adaptogens, which include tricrexin, metaproct, polyoxidum. The term adaptogens was introduced into scientific circulation by the understanding pharmacologist of the 20th century, professor of the pharmacology of the Naval Medical Academy, Russia, Nikolai Lazarev, who was also a pioneer in the use of xenon in medicine. Professor Lazarev also formulated criteria for classifying physiologically active substances as adaptogens. According to Lazarev, adaptogens should have the following properties. Number one, an adaptogen should have a wide range of therapeutic action, cause minimally changes in the normal function of the body. Number two, the action of the adaptogen should be nonspecific in the sense of resistance to the harmful effects of a very wide range of factors of physical, chemical, and biological nature should be increased. Number three, the effects of the adaptogen should be the more pronounced, the deeper the unfavorable changes in the body. Number four, the adaptogen should have a normalizing effect regardless of the direction of the previous shift in homeostasis. Therapeutical index, LD50, ED50, must be less than 100. As can be seen from the table, medical gases fully meet the criteria for adaptogens and significantly exceed the available synthetic adaptogen in terms of the therapeutic index. In accordance with the above considerations, we should change the implicit classification of medical gases as metabolites and place them in the class of adaptogens. Thus, we are making the last half step towards understanding the role and place of ozone, xenon, and possibly hydrogen as representatives of medical gases in modern pharmacology. It is my hope that this data will serve as a roadmap towards the recognition of medical gases as pharmacological agents. It is known that the criterion for the truth of a theory is practice, guided by the theoretical position according to which the long-term therapeutic effects of ozone therapy is based on the anticipatory conditioned reflex response of the body's adaptation system to ozone intoxication. We have developed a method for express diagnostics of the completion of the formation of an adequate homeostatic reflex to ozone and the method for accelerating the formation of the reflex using transcranial magnetic limbic stimulation systems and prefrontal areas of the cortex. The study was conducted on the example of ozone therapy as the most studied form of therapy with medical gases. These methods, as well as the very concept of conditioned reflex reactions as the basics of systemic therapy with medical gases, arose from the well-known fact of fluctuations in the psychosomatic state of patients during the course of ozone therapy and large differences in the final effectiveness of the course of therapy. The slide on the left shows the average result of a long-term study of the effectiveness of treatment of patients suffering from various diseases at the medical center of the Odessa branch of IAMGT. At the end of the course of treatment, patients were asked to assess the results of treatment on a 4-point scale: poor, satisfactory, good, and excellent. The results of treatment was assessed as if the poor patient's condition did not improve, even worsen during the treatment. A satisfactory result corresponded to a situation where the patient felt some improvement in his condition, but he expected more. Good and excellent results meant significant and very strong improvement in the patient's condition, respectively. As you see from the slide, the results of treatment of patients, regardless of the type and severity of diseases, are divided into 4 approximately equal groups, which means that there is more disregarded factors that determine the effectiveness of ozone therapy. The presence of such a factor also follows from the sharp fluctuations in the well-being of patients during the course of ozone therapy. An example of such fluctuations is shown on the slide. The blue line shows the dynamics of the estimated adaptation age of the patient suffering from hypertension according to the psychosomatic state questionnaire. The red dotted line shows the systolic blood pressure. It can be seen from the composition that a sharp improvement of the patient's condition after the first 4 procedures is replaced by an equally sharp deterioration after the completion of the course. The lower graph shows that the changes in health and blood pressure are also accompanied by changes in the concentration of monocytes and neutrophils in the patient's blood. Another evidence of the presence of a factor that is not taken into account in the practice of routine ozone therapy is the unusual nature of the dynamics of the patient's well-being after the completion of the course of the treatment. As you can see from the slide, the state of health sharply improves after the completion of a successful course of therapy, remains unchanged for several months after the completion of course, and then sharply deteriorates within 1 or 2 weeks. Suggested that this unaccounted for factor is the activity of the neuroendocrine system, which is involved in the formation of the Pavlovian conditioned homeostatic reflex in response to ozone intoxication. Indeed, the formation of a new reflex, in contrast to the simple reflexes described above, such as the anti-hypertensive and anti-glycemic reflex described above, is a complex task that requires several stages of adjustment. This process of tuning the neuroendocrine system is reflected in the form of changes in the leukoformula, cardiointervallogram parameters, blood pressure, and patient well-being. The new state of functioning of the endocrine system is fixed after the completion of the formation of the conditioned reflex and persists for several months. We believe that the above described features of the course of systemic ozone therapy fully fit into the scheme of the formation of a conditioned hemostatic reflex to ozone intoxication. In particular, a typical dynamics of the calculated adaptive age shown in the slide has three clearly visible stages. Number one, the formation of a conditioned reflex accompanied by fluctuations in well-being. Number two, a period of adaptive rejuvenation lasting for several months and being a simple consequence of an advanced conditioned reflex response to ozone intoxication during the course of ozone therapy procedures. And number three, the extinction of the reaction and the return of the adaptation age to the initial one, which is perceived by the patient as a disease. Our experience shows that if we carry out a short course of ozone therapy just before the end of the course of remission, then we can keep the patient in rejuvenated state for decades. The tactics for ozone therapy for primary patients and patients with repeated courses are described in detail on the website ozoneprotocols.org. Este es el 45.
Sí, sí, se quedó pegado.
Based on the concept we developed, we were able to improve existing approaches to systemic ozone therapy and increase the percentage of patients who consider the treatment results to be good and excellent to 86%. The study involved patients aged 35 to 64 years and suffering from a variety of diseases: coronary artery disease, hypertension, diabetes, metabolic syndrome, diseases of the spine, hepatitis and nephritis, etc. The key condition for the success of the course of therapy is express monitoring of the state of the adaptation system according to this leukoformula and cardiointervallogram. See ozoneprotocols.org. Transcranial magnetic stimulation of the brain is the second additional tool that can sharply accelerate the formation of a conditioned homeostasis reflex. Back in 1987, Professor Rosanov showed that magnetic stimulation of the rat brain accelerated the formation of conditioned reflexes. We use this finding in order to assess the possibility of increasing the effectiveness of systemic ozone therapy by accelerating the formation of a conditioned homeostatic reflex to ozone intoxication. For this, we have developed a special device for transcranial magnetic stimulation called Ozone and TBMS. A video of the procedure using transcranial magnetic stimulation in combination with autohemotherapy major can be viewed at the link indicated on the side. The slide shows the results of a study of the effect of 3 sessions of magnetic stimulation on the brain for 20 minutes in series of 50 pulses with a pulse repetition rate of 10 hertz. The pulse energy of the electromagnetic field was 24 J per pulse. The psychosomatic state of patients was assessed with using the standard SF 36 questionnaire. As can be seen from the diagram on the left, the course of the procedure for magnetic stimulation of the brain causes only a transient increase in the parameters of mental and general health. At the same time, the combined use of intravenous infusion of ozonized saline and magnetic stimulation of the brain causes persistent increase in the parameters of role functioning and vital energy for several months. Conclusion. Number 1. Medical gases are generally toxic. Molecular hydrogen is an exception to this rule. However, the toxicity of ozone and xenon is associated with the effect on the neuroendocrine system. In the case of ozone, the toxicity of the gas is sharply reduced by the selective inhibitor of the synthesis of corticosteroid midotropone. The physiological activity of molecular hydrogen is also mediated by a hormonal stomach-brain relationship. Number 3. The therapeutic effects of systemic use of at least 2 of the 3 most well-studied medical gases are directly opposite to their toxic effect. Thus, it is the toxicity profile of ozone and xenon, and possibly hydrogen, that determines the profile of their therapeutic properties. This allows us to assert that these gases do not have their own beneficial effect on the body like classical drugs, and their therapeutic effect arises as a result of the body's protective response to their toxic effect. Taking into account the well-known fact that, number 4, taking into account the well-known fact of the existence of a universal protective reflex of the body to any, including chemical, effects that violates its homeostasis, it can be concluded that the therapeutic effect of these gases is the result of a reflex homeostatic reaction. The continuity of the therapeutic effect of these gases is determined by the formation of a conditioned reflex anticipatory reaction of the body to a course of gas intoxication. Number 5, the concept of the conditioned reflex essence of the therapeutic activity of medical gases was named conditioned reflex hormoligos, from the Greek hormoa, an existing hormone-like action, oligos, small amounts. Based on this concept, a tactic has been developed to optimize and accelerate the formation of a conditioned reflex to intoxication with medical gases. As a result of following this method, it is possible to increase the percentage of patients experiencing psychosomatic recovery as a result of the course of ozone therapy from 2.5 to 3 times, and reduce the course of treatment by 2 to 2.5 times. For this convenience of using this tactic, the O3 Navigator Internet program, which can be found at the ozoneprotocols.org, as well as the equipment, which can be found on ozonetherapy.org, has been developed. Best wishes from Odessa, and thank you for your attention.